If you like your plan, you can keep your plan. We thought things couldn't get worse, but ever since Obamacare became the law of the land and they instituted this marketplace, things have only gotten worse, haven't they?
Yeah, I mean, it's interesting. You hear so many people talking about monopolies these days. You have your Elizabeth Warrens on the left, you have your Josh Hawleys on the right, and they're constantly going after all these companies that are not monopolies, right? They're just in the tech sector and they don't like them, but they're not monopolies. What you don't see them going after are the true and long-lasting monopolies, which are usually only the ones that government has created and continues to back. And I think you cannot point to a sector where there is more of that than the health market right now in this country. It is so completely overrun with government, period. You can barely define it as a capitalist landscape, even, at the fringes at this point. But particularly around the insurance companies, what happened under Obamacare is it was a massive corporate welfare grab bag. The insurance companies lobbied for this, right? I don't know how people are still thinking that like Obama came and like stuck it to the man with his Obamacare plan. No, they wanted this. They knew that it would get them a lot more money. We've seen a real consolidation of power since Obamacare was passed and implemented. And what we know right now is that, yes, they can claim that a high percentage of Americans have health insurance, but health insurance is not health care. And actually, what has happened over that time period is that health care itself has become less and less affordable. You have entered a marketplace where you have fewer and fewer options, even under your health insurance plans. The cost of those plans, those premiums, have doubled. And the vast majority of the money being spent has gone to the insurance companies. We're spending something like 18% of our GDP on healthcare right now, but 90% of those dollars are controlled by the government and the insurance companies. So this is disgusting. This is something that has basically empowered these companies that treat all of us terribly. I don't know what your experience has been like in recent years with your health insurance, Austin, but I've been fortunate to always have insurance since graduating college in 2010, mostly employer-based healthcare. Ever since starting my own business in 2022, I've been having to pay out of pocket. The premiums are close to $500 for somebody who's very young and very healthy. It's absolutely ridiculous. And even then, that's not getting me health care. I still have to come out of pocket a lot if I want even basic procedures. They often try to deny me basic procedures that could be life-saving. I've talked about this a lot, but last year there was a lump that was found on my breast and they wouldn't biopsy me. They said, come back in 6 months. I was like, what? I'm not coming back in 6 months. I could be dead in 6 months for all you know. And they're like, well, we're just not that worried about it. I had to fight an uphill battle just to get a biopsy done. And because my insurance didn't want me to get it done at that point, I had to pay like $2,500 and that's something most people can't do. They can't just come out of pocket $2,500. The average American doesn't have $1,000 in their bank. So, I mean, it's just absolutely horrendous. And I think at the end of the day, the right has to start coming up with its own solutions. We can't just keep saying this is bad, this is bad, this is bad. I think most people are pretty aware of that at this point. We've got to start talking about how to give power back to patients.
God, Hannah, hearing you say that, it just reminds me of my own situation. So after about 15 to 20 years of doing, martial arts and karate kicks, I've actually blown out two of the discs in my lower part of my vertebrae. And insurance won't cover the steroid injections that I need to be able to stop the pain. So I'd have to pay for those out of pocket, despite paying thousands of dollars a month already in health insurance costs. I still would have to pay out of pocket for those injections. But of course, I have a baby on the way here in about a month and a half. So the question is, do I want to pay, $800 to almost $1,000 to get these steroid injections, or do I want to feed my baby? So I basically had to make the decision a couple weeks ago that you're just gonna have to live the rest of your life in pain, and either get over it, live your life in pain and suffer and struggle, or take care of your child. The only way out is you have to get rich. That's really, if you want to be able to get good health care in this country. We're starting to get into a Canadian style situation where it's like, you're talking about those wait lists. Oh, we're going to wait 6 months. I mean, this is what we're hearing from the dreaded North about what's happening in Justin Trudeau's Canada. This is what the left has been trying to move here to the United States. Even Bill Maher came out on his show a few weeks ago and was ripping on Canada, saying the healthcare system's not that great anymore, guys. Now the whole joke around Canadian healthcare is like that, if you're depressed or lonely, they're like, oh, well, commit euthanasia, so they don't actually have to take care of you, Hannah. But let's focus on what people are actually trying to do here in the United States. There was a hearing on Capitol Hill where they're talking about these quote unquote healthcare monopolies that the government actually created. So what happened there at that meeting?
Yeah, so there's a lot of movement actually happening beneath the surface. Before I get to that, I just want to affirm what you just said. You're absolutely right. These universal healthcare systems, they're collapsing. I've covered this on multiple versions of my show on YouTube, especially. I've looked at Canada's system, I've looked at England's system, I've looked at most of the countries in Europe systems. They are collapsing. People cannot get care. They are coming to the United States, or they're using medical tourism visas to go elsewhere to get basic care. And I'm not talking, cosmetic or like optional surgeries. I'm saying to get a basic transplant, to get things that like should be readily available. They can't get it there because there's not enough beds. And that's because these systems don't work. You need profit incentives in healthcare in order to have the enough supply to meet the demand. That is essential. What we've been doing in this country since the early 1900s is intentionally restricting that supply. We do that through certificate of need laws across the country. We do that by limiting how many people can go to medical school. It goes on and on and on. So I think during this hearing, you heard a lot of people talking about what essentially has been a monopolization of this industry. You've seen a lot of companies combining. You see increasingly a landscape where doctors are being pushed out of private practice. They are having to go and work for these large hospital associations, and that is by design. So you have certificate of need laws that are in the states. They basically say that in order to open a new hospital, in order to open a new medical facility in general, to add beds, to add new equipment, you have to go before a government appointed board and argue why you need it. And then your competitor, which is usually the one or two large hospital associations that you have in a state, the monopolies, they get to come in and argue why you don't. And you can guess who wins out typically. And so that is something that's been restricting supply on the front end. And then on the back end, you have another restriction where you have the federal government that is actually paying hospital associations higher reimbursement rates for Medicare, for Medicaid, for services that they're providing. And so the independent doctors can no longer compete with that landscape. And so what ends up happening is they're having to give up their private practices. They're going and working for the hospital associations. And ultimately what that means is you have far fewer choices in the doctors that you get to see and the services that are covered and what the prices of those services even are. And then the doctors themselves increasingly have so little control over their client-patient relationships because they are told by the hospital associations, you have to push this vaccine, you have to push this talking point, you need to get them on these medications, versus being able to explore alternative pathways, being able to customize healthcare plans. They have less time to spend with the patients. It's becoming a factory where they're just trying to get people in as fast as possible. And so these are a lot of the things that you heard discussed in these hearings. And I think it's something that maybe Americans are aware of when they go to the doctor, when they're trying to figure out, their own health portfolio or their plan for how they're going to care for their needs. But I don't know if people recognize that it's happening en masse and just how significant of a problem it really is.
Yeah, one of the most successful talking points for the movement to try and advance school choice here in this country by our friend Corey DeAngelis is he says, fund students, not systems. And one of the big activist groups that's out there is trying to advance these ideas of like healthcare, more so healthcare savings accounts. So kind of like a similar role for our healthcare versus what we're doing here in school choice. It's essentially we're trying to look at funding people, not health insurance, right? So we're trying to kind of, it's like school choice, but for healthcare, right? I mean, one of the most powerful talking points for people like ourselves when we're out there trying to advocate for more free markets and breaking up the government created cartels in our health insurance system is to say that we look at things like healthcare savings account because they create a little bit more of a market incentive and the money goes to the patient versus to the health insurance system, right?
Yeah, I'm excited to nerd out about this, Austin. We need to talk about HSA accounts in this country so much
Yeah.
more than we do. And yeah, I think this is an exciting development. You and I are pragmatists. We've talked about this a lot. I think the problem that you often see when, especially when you get into libertarian circles, is they want this like Puritan ideology, right? All the way over here. The reality is that the government is so intertwined in healthcare and in education that you're not getting the government fully out of these pictures. You're not getting to a libertarian utopia anytime in the next decade, for sure, probably longer than that. And so I would agree. I wish the government wasn't involved in spending healthcare dollars at all. I wish this wasn't the landscape that we're in. But since we are, the most pragmatic approach and the best way to start moving towards that utopia, moving back towards a truly capitalist system, is to at the very least make sure those dollars are going back to the taxpayers, right? That is the first step in this equation. I think school choice gets that right as the perfect next step. I think when we're talking about healthcare, HSAs are probably that equivalent. You have heard this referred to by like the Stand Together Network as a personal option. There's another group, Patients Rising, I work with, that is really focused on something called the Access Act, which Republicans out of Florida are sponsoring right now. It's Kat Kamek and Greg Stubbe, young, upcoming kind of superstars on the right. And it's a great idea. And ultimately it gets down to the factor of HSAs, which did you know less than 10% of the country can access an HSA as of right now? They're very hard to get your hands on, actually. If you do end up with one, hang on to it with your life, because if you switch jobs or your job switches their insurance, you're very likely to use it. But HSA accounts basically are similar to ESA accounts. Like in school choice, you can put tax-free dollars in them before your tax out of your paycheck, and they start to earn interest. And then you have a lot more control over that account, where you want to use those dollars, the kinds of services you want to apply them towards. So like for me, I also have a lot of back issues. I have sciatica. So I have found the best thing for me in my back health is to get regular massage therapy, reflexology, and also to do yoga very regularly. My health insurance won't cover that. That's the best thing for me. My health insurance would cover me going to a chiropractor, which that's a personal choice. It's not what it's going to work for me. It would cover me getting medications. It would cover, all kinds of other solutions that might have secondary side effects or that might harm me. It won't cover what I know works. An HSA account would. I could say these are healthcare services. I need this for my health, and I could then allocate those dollars. But I think the most exciting thing about HSA accounts is that interest I mentioned, that they're accruing over time. And so HSA accounts actually are considered kind of a 401k for healthcare. So you can start investing in those dollars. They can start accruing interest. And if you let it compound over time, by the time you're older and you're starting to have a lot more health expenses, you've got this nice nest egg that can help cover you. And guys, that's really essential, because for those of you not paying attention, Medicare is going broke. Social Security is going broke. There is no guarantee these plans will even be there by the time we get older. And even then, they do not cover everything, right? There's been a lot of conversation about the things that Medicare does not cover, the expenses of those. And so you can only expect those to continue to increase if we don't get back to more of a capitalist system in the healthcare sector. So this is something that could be life-changing for many people. The Access Act, just to explain, is kind of the first step in trying to get more people the ability to access HSA accounts. And the way it would work first is it would look at about 5 million people who are currently on Obamacare and who are considered low income earners. Currently, they get a subsidy on their plans. That's something taxpayers are paying for. But Austin, it doesn't go to them. It goes to the insurance companies, who then continue to raise their rates, enrich themselves, and do nothing to actually bring down the cost of healthcare or ensure these people have better access to it. And so instead of enriching the insurance companies, maybe we should just give those dollars directly to the patients in an HSA account, so that they have more control, so that they can actually access real healthcare, and so that hopefully they can be smart and invest and save for their future, so that we're not picking up an even greater tab down the road. So this would save a lot of money. It's also, I just think, the better approach, the next step towards a capitalist system. It's a great idea. And ultimately, I think anything right now that undercuts the actual monopolies controlling the health sector, controlling the insurance companies, that's a good progression in my book.
Man, there's going to be a lot of killer sound bites. I can't wait to clip out of this interview, Hannah. But is there anything else that you think we need to cover on this subject before we let you go today?
No, but I hope people pay attention. I think healthcare is often one of the conversations that doesn't make it quite to the national level. You're not going to see, CNN covering this. You're not going to see Trump waxing poetic about it, but it's really important. It's really something that we've got to get serious about. We need to get back to fixing the policies in this country. And excitingly, I think there's a time where there's something we can do about it, right? This is something people on the left and right can come together on. So I hope people plug in. I hope they start paying more attention. I hope they call their state lawmakers. I hope they raise their voices, because there are solutions on the table, and it's time that we have access to them.
Love it. Hannah Cox, where can people follow you more and find out more about this online?
Yeah, they can go to my Twitter, Hannah D. Cox. They can go to my YouTube, which is just Hannah Cox, and pretty much any social media platform, you'll find me under a similar handle.
You love to see it. Well, with 1,000 people watching us over at rumble.com and lots of more joining us over at x.com, I think we'll get you a few more extra follows this morning, Hannah. So hopefully it'll be worth it that you had to get up so early and get all made up. We appreciate you, Hannah. We look forward to having
Thanks,
you back
Austin.
again real soon. You have a wonderful day.
You too.
Let's give Hannah Cox a round of applause. What say you, ladies and gents?